All right, today we're going to talk about a really common infection, one that often works in secret. We're talking about gonorrhea. So let's just dive right into the facts. Just so you know, all the information and the slides you're about to see come from a guide put together by the folks at DIRCAT Premium Revisions. They're great at breaking down these kinds of complex medical topics.
So what if a disease's biggest threat was its silence? I really want you to keep that question in mind as we go through this, because with gonorrhea, it's often what you don't see. Well, that's the most dangerous part of the whole story.
Okay, so first things first, let's get a handle on what we're actually dealing with here. What exactly is this common intruder?
So, at its most basic level, gonorrhea is a sexually transmitted infection, an STI. The culprit is a specific bacterium, Neisseria gonorrhoeae. And you know, for such a tiny little organism, it can cause some pretty major health problems.
So how does it get around? Well, there are really two main ways. The one we hear about most is, of course, through sexual contact. That's vaginal, anal, or oral. But there's another way that's absolutely critical to understand. It can be passed from an infected mother to her baby during birth. And that can have really, really serious consequences for the newborn.
All right, and this is where the story gets, well, complicated. The way someone experiences this infection can be completely different, and it really just depends on who you are.
I mean, just look at the difference here. It's a tale of two completely different experiences. For men, the signs are usually pretty obvious. You're talking about noticeable discharge, that burning feeling when you urinate, other clear pains. But for women, the number one feature is nothing, being completely asymptomatic, no symptoms at all. And even when they do show up, they can be so subtle that they're easy to just brush off as something else entirely.
And that right there, that's the whole problem in a nutshell. The infection is often asymptomatic in women. That one single fact is the reason it can hide, go completely undetected and untreated for so long, and that's what leads directly to its most serious dangers.
So, okay, what are the hidden dangers? What happens when an infection like this is just allowed to do its thing in silence? Well, the consequences can be profound, and in some cases, they're permanent.
For women, this is a really big deal. That silent, untreated infection can actually travel up into the reproductive system. This causes a really serious condition called pelvic inflammatory disease, or PID. And what PID does is cause inflammation that can scar the fallopian tubes, which can lead to chronic pain and, just tragically, infertility.
And it doesn't stop there. The bacteria can spread to other parts of the body too. It can cause inflammation around the liver, that's called Fitzhugh-Curtis syndrome. Or it can get into the bloodstream and cause things like arthritis and skin rashes. And remember we talked about newborns? If they're exposed during birth, they can get a severe eye infection called ophthalmia neomatorum, and if that's not treated right away, it can actually lead to blindness.
Okay, so that's the problem, and yeah, it's pretty serious. But here's the good news. We have really effective ways to fight back. So let's shift gears and talk about how we find this intruder and how we get rid of it.
So doctors have a few different tools in their toolbox for diagnosis. The best one, kind of the gold standard, is a super sensitive test called a NAAT. It basically looks for the bacteria's DNA, so it's very accurate. Then you've got cultures, where they actually grow the bacteria in a lab. This is really important for checking if a particular strain is resistant to antibiotics. And finally, there's the gram stain, which can give a really fast initial result, especially for men who are showing obvious symptoms.
And once it's diagnosed, the treatment is usually pretty straightforward and, thankfully, very effective. The standard approach is just a single shot of an antibiotic called ceftriaxone. Now, here's an interesting thing. Gonorrhea and another STI, chlamydia, often show up together. So to cover all the bases, doctors will frequently add a single dose of another antibiotic, azithromycin, just to be safe.
Of course, it's not always one size fits all. There are protocols for special cases. Say a patient has a penicillin allergy, no problem, there are alternative antibiotics. And for newborns, that protective erythromycin ointment is applied to their eyes as a routine measure, just to prevent that dangerous eye infection we were talking about earlier.
So treatment is great, it works. But you know what's even better? Prevention. So for this last part, let's talk about how to take control and protect not just yourself, but others too.
The prevention toolkit is actually pretty simple, but it's incredibly powerful. First up, safe sex practices. Using condoms is just a highly effective way to cut down on transmission. Second, and this one is absolutely crucial, is partner notification. If you test positive, your partners have to be told so they can get tested and treated. That is how you break the chain of infection.
And finally, if you're in a high-risk population, getting screened regularly is just key.
So if you take away just one thing from all this, let it be this. The real danger is the silence. It's gonorrhoea's ability to hide, especially in women, that lets it cause such severe, sometimes life-altering problems. And the only way we can really stop it from spreading is to make sure that when one person gets treated, their partners do too. It's that simple.
And that brings us right back to that question from the beginning. But now we see it a little differently, right? Now that you know the facts, how do we turn this information into action? Knowing about the silent threat, that's step one. The next step is doing something about it. And that means open conversations, regular screening, and just taking responsible care of ourselves and our partners. Thanks for joining me for this one.